Most people brush off an itch as nothing more than dry skin or a passing irritation. But what if your body is trying to warn you about something serious, something life-threatening? In today's video, we're uncovering 3 specific itchy areas in older adults that could point to underlying health issues, and in some cases, even signal a shorter lifespan. These signs are often ignored until it's too late. But if you know what to look for, you can catch the warning early and possibly change the outcome. Stay with us, because what you're about to learn could truly make all the difference. The silent signal we all ignore. It starts as a simple itch, no rash, no visible irritation, just a nagging sensation that won't go away. Most people chalk it up to dry weather, aging skin, or maybe a change in detergent. But what if that harmless itch is actually your body waving a red flag? For many older adults, persistent itching in specific areas isn't just annoying. It can be a subtle signal that something's not right beneath the surface. The body has a strange way of warning us, and sometimes it's the most minor symptoms that point to major health issues. Unfortunately, these early signs are often dismissed, brushed off as normal or irrelevant. That's when the real danger begins. After the age of 60, the skin naturally becomes drier due to a decline in sweat and oil gland activity. But when itching is localized, persistent, and doesn't improve with lotions or over-the-counter treatments, it can hint at internal dysfunction. We're not just talking about discomfort. We're talking about conditions that can seriously shorten your lifespan if left unchecked. Take a moment to consider this. How often have you, or someone you know, ignored a strange symptom simply because it didn't look serious? An itch isn't as alarming as chest pain or a lump, but in some cases, it's the first and only warning before a serious diagnosis. Diseases like lymphoma, diabetes, and thyroid disorders can all begin with nothing more than itching in a specific part of the body. The challenge is that most of us don't connect skin sensations to internal disease. We assume it's allergies, dryness, or even just aging. But the truth is, your skin is the largest organ of your body, and when something inside is off balance, it often shows up there first. The goal isn't to panic at every itch, but to pay attention. Persistent, unexplainable itching that lingers for weeks or months could be your body's silent scream for help, especially when it affects the same spot repeatedly. So before you ignore that strange sensation again, ask yourself, what if it's more than skin deep? Because when it comes to your health, early awareness can be the key to a longer, healthier life. And now, let's look at a real-world example that reveals just how serious this overlooked symptom can become. Case study. Mrs. Jiang was 60 years old when the itching began. At first, it was nothing more than a light irritation, barely noticeable and easy to ignore. She assumed it was the dry autumn air, maybe a reaction to her soap, and applied some lotion hoping it would fade away. But it didn't. As the weeks passed, the itch intensified. It wasn't just uncomfortable, it became constant. No creams worked. No remedies gave her relief. And strangely, the skin in the area looked completely normal. There was no rash, no redness, nothing you'd expect from such an intense sensation. But that wasn't all. Alongside the itching, Mrs. Jiang started losing weight rapidly, even though she hadn't changed her diet. That's when she knew something was wrong. After months of tolerating the discomfort, she finally went to the hospital for a full checkup. The diagnosis? Lymphoma. A word she never expected to hear, especially linked to something as ordinary as itchy skin. Doctors explained that the cancer had been quietly developing in her lymphatic system, affecting her immune cells, specifically the lymphocytes. These abnormal cells had begun releasing histamine and other inflammatory chemicals into her bloodstream, eventually triggering the constant itch. In fact, studies show that around 20% of lymphoma patients experience persistent, unexplained itching as one of their first symptoms. What's frightening is how easily this warning sign could have been overlooked, as it often is. Many patients like Mrs. Jiang don't discover the real cause of their symptoms until the disease is already advanced. This case underscores a powerful lesson. Not all itches are skin deep. Sometimes they're your body's way of pointing to something hidden, something serious. The danger lies in dismissing these symptoms as minor. Lymphoma, a cancer of the lymphatic system, can form almost anywhere in the body. Because lymphocytes travel through blood and tissues, the signs can appear vague, like fatigue, weight loss, or yes, itching. And because those signs are so common and nonspecific, many people miss the early warnings. Mrs. Jiang's story isn't just a case of bad luck, it's a wake-up call. If an itch sticks around, resists treatment, and comes with other symptoms like fatigue or weight loss, don't ignore it. Getting checked could mean the difference between catching a disease early or finding out when it's already too late. Next, let's examine a more common but equally overlooked area where persistent itching could spell serious trouble. Itchy armpits. It's one of the last places people expect a health warning to show up, but the armpits can reveal more than just sweat. In fact, persistent itching in the armpits, especially without a rash, can be one of the earliest and most overlooked signs of diabetes. Diabetes doesn't just affect blood sugar, it slowly impacts nearly every system in the body, including the skin. One of the first things to change? Your skin's ability to stay hydrated and protect itself. As blood sugar levels rise, nerve endings begin to misfire, sweat glands underperform, and the skin becomes dry, irritated, and more vulnerable. This chain reaction can create an itch that feels like it's coming from deep under the skin, especially in sensitive, warm areas like the armpits. Unlike seasonal dry skin or an allergic rash, this kind of itching doesn't come and go with weather or products. It's constant, stubborn, and often appears without any visible signs. No redness, no bumps, just a maddening, unexplained itch. But that's not all. For those who are overweight or insulin resistant, the armpit becomes the perfect storm for irritation. Increased sweating, poor ventilation, and friction can turn the area into a breeding ground for fungal and bacterial infections, which only make the itching worse. What makes this symptom especially tricky is how easily it's dismissed. Most people never think to connect itchy underarms with blood sugar levels. They try deodorant changes, creams, or simply wait it out. But for some, this itch is actually their first clue that something inside their body is starting to go off track. Doctors warn that itching caused by diabetes often worsens during the colder months, when skin is drier and less resilient. And since it's not always accompanied by classic diabetic symptoms like thirst or fatigue, it can go unnoticed for years until more serious damage is done. If you're experiencing persistent armpit itching that doesn't improve with basic care, and especially if it's combined with other symptoms like frequent urination, fatigue, or blurry vision, it's time to get checked. Early diabetes detection could save you from years of hidden damage and help stop the itch at its root. Next, we move to an even more uncomfortable topic, but one that could be even more revealing: anal itching and the serious issues it may be hiding. Anal itching. It's uncomfortable, it's embarrassing, and for many people it's something they never talk about. But persistent anal itching isn't just a minor irritation. It can be a serious red flag for underlying health problems that are far more dangerous than most realize. In the beginning, it might feel like a small annoyance, an itch that comes and goes, often worse at night. But as time passes, that itch can become relentless, unmanageable, and even painful. It can interfere with sleep, daily activities, and emotional well-being. Yet most people choose to suffer in silence, too embarrassed to seek help. Here's why that's a mistake. While occasional itching might be caused by poor hygiene, mild irritation, or temporary inflammation, chronic anal itching can be a symptom of far more serious issues. Conditions like hemorrhoids, anal fissures, or fungal infections can trigger long-term discomfort. But in more severe cases, rectal cancer or anal cancer may also begin with this exact symptom. Hemorrhoids, for example, involve swollen veins around the rectum that can become itchy and painful, especially when inflamed. Anal fistulas, abnormal connections between the rectum and the skin, often leak fluid that irritates the surrounding skin. Both are physically uncomfortable and emotionally draining, but it's the more sinister causes that raise the most concern. Rectal or anal cancers often start silently, and itching may be the only symptom in the early stages. Over time, other signs like bleeding, pain, or changes in bowel habits may emerge, but by then, the disease could be far more advanced. The challenge? Many people normalize the discomfort. They blame spicy food, hygiene habits, or stress. They may even self-treat for months without improvement, not realizing that their body is sounding an alarm. If the itching is persistent, worsening, or accompanied by bleeding, discharge, or swelling, it's time to see a doctor. Early intervention can lead to faster diagnosis, less invasive treatment, and a far better outcome. Bottom line, don't ignore anal itching just because it's awkward to talk about. Your comfort, dignity, and long-term health matter far more than a moment of embarrassment. Coming up, we explore another highly sensitive area, one where chronic itching could point to gynecological issues or hidden infections. The genital region. Genital area. Itching in the genital area is often brushed off as something minor, a reaction to a new soap, tight clothing, or poor hygiene. But when the irritation persists, especially in older adults, it may be more than just a surface issue. In women especially, genital itching can be an early clue to deeper gynecological problems, some of which may carry serious long-term health risks. One of the most common causes is vulvitis, an inflammation of the external female genitalia, often triggered by an imbalance in the natural vaginal flora. When healthy bacteria are disrupted, whether due to age, medications, or hormonal changes, it creates an opportunity for harmful bacteria or yeast to thrive. The result? Redness, swelling, and an intense itching sensation that won't easily go away. But vulvitis is just one part of the picture. Other culprits include vaginitis, genital eczema, scabies, and even genital warts. Each presents differently, but all can cause chronic irritation that worsens with scratching and often leads to a cycle of inflammation, infection, and discomfort. What makes this worse is that many women delay seeking care out of embarrassment or because they believe it will resolve on its own. One of the more concerning issues is that itching in this area can also be an early indicator of more serious gynecological conditions. For example, certain types of vulvar cancer may begin with mild itching or irritation. Without visible lesions or other obvious symptoms, it's easy to mistake these early signs for something benign, until it's too late. Age also plays a role. In postmenopausal women, declining estrogen levels can cause thinning of the vaginal and vulvar skin, making it more prone to dryness, tearing, and chronic irritation. Many women assume it's a normal part of aging, but it doesn't have to be endured in silence. What's important to remember is this: genital itching that persists beyond a few days, resists treatment, or worsens over time should never be ignored. Proper diagnosis is essential to uncover the root cause, whether it's an infection, inflammation, or something more serious. If you're experiencing recurring genital irritation, seek medical attention. Relief is possible, and in some cases, early detection can make all the difference. Next, let's look at another often ignored spot where persistent itching may be far more than skin deep: the lower legs, and how they could point to a hormonal imbalance hiding in plain sight. Lower legs. When people think of thyroid problems, they usually imagine fatigue, weight gain, or cold intolerance, not itchy legs. But in many older adults, persistent itching on the lower legs may be one of the first signs of an underactive thyroid or hypothyroidism. The thyroid is a small gland with a massive job. It regulates your metabolism, influences energy levels, body temperature, and even skin health. When it slows down, everything else does too, including the production of natural skin oils that keep your skin soft and hydrated. The result? Dry, flaky, and often unbearably itchy skin, especially in areas where oil glands are fewer, like the lower legs. What makes this kind of itch especially frustrating is its resistance to typical skin treatments. You can apply all the lotions and creams you want, but if the root cause is hormonal, the relief will be temporary at best. And while dry skin alone may not seem dangerous, when it's caused by a systemic imbalance, it could be an early warning of broader health issues that need immediate attention. Itching caused by hypothyroidism tends to worsen during the cold, dry months when environmental moisture is already low. The skin may feel tight, scaly, or rough, and often appears pale or cool to the touch. In some cases, people also experience tingling sensations, making the discomfort even more difficult to ignore. This isn't just about dryness, it's about slowed skin cell turnover, poor circulation, and reduced sweat production. In more advanced cases, untreated hypothyroidism can lead to cracked skin, increased risk of infections, and overall reduced skin resilience. And since these changes develop gradually, many people chalk them up to just getting older. But here's the truth. Itchy lower legs that don't go away, even with consistent moisturizing, deserve a second look. If you also experience symptoms like fatigue, weight changes, cold sensitivity, hair thinning, or depression, your thyroid could be the silent culprit. Don't let this signal go unnoticed. A simple blood test can reveal whether your thyroid hormones are out of balance, and treatment can make a huge difference, not just in your skin, but your energy, mood, and overall health. Next, let's break down the key differences between two common forms of itching, dry versus damp, and how each one tells a different story about what's happening inside your body. Dry versus damp itching. Not all itching is created equal, and according to medical experts, the type of itch you experience can reveal critical clues about what's happening beneath your skin. Dr. Wang, a respected dermatologist from Wangjing Hospital, explains that most chronic itching in older adults falls into one of two categories, dry itching and damp itching. And understanding the difference could help uncover hidden health problems before they escalate. Let's start with dry itching, the most common form, especially in elderly individuals. As we age, our skin naturally becomes thinner and loses its ability to retain moisture. Sweat and oil production decline, making the skin more prone to tightness, flaking, and rough texture. This is especially noticeable during autumn and winter, when cold air and indoor heating strip away moisture even faster. The itching usually appears on areas like the arms, back, and lower legs. And while it's uncomfortable, it's generally not dangerous. Still, untreated dry skin can crack, bleed, and become infected, especially when scratched repeatedly. Now, damp itching is a different story. This type is often caused by internal imbalances, specifically dysfunctions in the liver, kidneys, or blood sugar regulation. These organs are crucial for filtering toxins, regulating hormones, and maintaining proper skin function. When they're not working properly, waste products can build up in the body, and one of the first places those effects show up is the skin. Damp itching usually affects moist, sensitive areas like the armpits, groin, or anus, and may be accompanied by darkening, swelling, or even secondary infections like folliculitis or lymphangitis. Unlike dry itching, which looks flaky and pale, Damp itching areas may appear reddish, shiny, or even sticky, and the skin often becomes more inflamed the more it's scratched. The key difference? Dry itching is usually caused by environmental or age-related changes, while damp itching is often tied to deeper health problems like diabetes, liver disease, or kidney failure. That's why it's so important to notice not just where the itching is, but what it feels and looks like. If you're dealing with persistent itching, dry or damp, and it doesn't respond to basic skincare, it may be time to dig deeper. Identifying the cause early can lead to the right treatment, better comfort, and even life-saving intervention in some cases. Up next, we'll talk about how to tell when itching is harmless and when it's time to seek help. What to do? Itching might seem like a minor annoyance, but as you've seen, it can sometimes be the body's way of whispering that something's wrong. The key is knowing when to treat it at home and when to stop guessing and get checked. Let's start with prevention. For dry itching, the most common type in older adults, the solution often lies in simple daily habits. Keeping the skin well moisturized, especially after bathing, helps lock in hydration. Use fragrance-free lotions and creams designed for sensitive skin. In colder months, reduce the number of hot showers, which can strip away natural oils. And don't underestimate the power of hydration and nutrition. Drink plenty of water and eat foods rich in vitamins A, C, E, and healthy fats that support skin health. Avoid scratching, even if it brings temporary relief. Repeated scratching breaks the skin barrier, making it easier for bacteria to enter and cause infection. Instead, use cold compresses or anti-itch creams recommended by a dermatologist. But what about itching that doesn't go away? That's when it's time to take things seriously. Persistent itching that lasts more than 2 weeks, especially when localized to one area, requires medical attention. Even more urgently, if your itching is accompanied by unexplained weight loss, fatigue, night sweats, swelling, or visible skin changes, these could be early signs of something far more serious, like lymphoma, thyroid disease, diabetes, or even cancer. Don't try to self-diagnose. Itching linked to internal conditions won't go away with skin creams because the root cause isn't skin deep. Instead, consult a healthcare provider for a full evaluation. A simple blood test can check thyroid function, liver and kidney health, blood sugar levels, and more, often revealing hidden issues before other symptoms appear. Remember, the earlier a condition is caught, the easier it is to manage or even reverse. So if something feels off, listen to your body. Don't let embarrassment or the fear of overreacting keep you from getting answers. Because in many cases, itching isn't just an inconvenience, it's a warning. And taking action now could mean protecting your health, your comfort, and even your life. Up next, we'll wrap everything up with a powerful reminder of why these symptoms matter and what you can do to protect yourself and your loved ones. Itching may seem small, but it can reveal some of the body's biggest warnings. Don't ignore the signs. Your health may depend on it. If you found this video helpful, hit that like button, subscribe, and turn on the bell so you never miss vital health tips that could make a real difference. Stay informed, stay aware, and take care.